This is Dr. Jacome. I'm a bariatric surgeon from Augusta, Georgia. The topic that we're going to discuss today is ulcers after bariatric surgery. Ulcers after bariatric surgery is not a common thing to have. Why do ulcers happen? It depends on the kind of procedure that you have. Some of the procedures have a higher risk of developing an ulcer compared to others. In this case, the bypass has a higher risk to develop ulcers compared to the sleeve as well as the duodenal switch. In the case of the sleeve and the duodenal switch, ulcers are not very common, but things that can create an ulcer are things like smoking or taking a significant amount of incense. The risk is not very high, but those are things that you certainly need to avoid. In the case of the gastric bypass, this surgery is more prone to develop ulcers, and the reason is because there is a piece of the small intestine that has not seen acid nor food before, now connected to the small pouch, and is receiving a small amount of acid as well as food. This intestine tries to adapt to this, but things like smoking and the use of NSAIDs will for sure make the patient develop an ulcer. What actually is an ulcer? An ulcer is an erosion on the mucosa of the stomach or the small intestine. So as you can imagine, certain complications that can happen because of that erosion can be bleeding as well as perforation. Both can turn into an emergency, so it's very important that if you're having difficulty with pain, especially on the upper part of the stomach or sensation of burning or pain after eating, to make sure you go to your physician and you notify him of these problems that you're having. Ulcers can be treated in many different ways. So the first step in treating an ulcer is, number one, to make sure we don't do anything that could be creating an ulcer. So in the case of smoking, would be a smoking cessation or not taking anti-inflammatory medications. But also at some point the use of medications, which could be the medications that we call PPIs, which are omeprazole, pantoprazole, medications that we call them H2 blockers, which is famotidine, and also medications that can cover the lining of the stomach to help heal, and one of those medications will be Carafate. If the use of medications does not work or the patient develops complications related to ulcers, sometimes surgery is required to be able to cut the ulcer out and create a new connection in the case of the gastric bypass. If an ulcer bleeds, sometimes they can be controlled with the use of clips or the use of endoscopy with some injections, but if this is not doable, then surgery is required. Now, what happens if an ulcer perforates? That is a very complex emergency. It carries a significant risk of death. You just got to take into account that a perforated ulcer means that you have a hole on the stomach or your connection that is leaking to the outside of the intestine, things like food and acid. So this is a pretty severe emergency and needs to be treated surgically. Outcomes are pretty good, but it is important to make sure you talk with your physician before developing any of these emergencies. Thank you for watching. If you like the topics, please subscribe. We'll see you next time.